Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. Deepa Halaharvi, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. Hi, everyone. Welcome back to the Breast Cancer Podcast. I have Dr. Shabana Dewani with me today, and we are talking about male breast cancer. And she's a medical oncologist here in Columbus, Ohio. And I've been so grateful that she's been a guest on this show for so many times. And her podcast is actually one of the most downloaded podcasts in the
Oh my
history.
gosh.
Did you know that?
No.
Yeah. So, the Breast Cancer Podcast, I'm very happy to report that it's in 120 countries and we have near 70,000 downloads. And Dr. Diwani's podcast in the past has been the most commonly downloaded podcast. And
Thank you for sharing that.
yeah, I didn't tell her that till now. And you'll see why, because she's full of knowledge and wisdom. And today we're going to be tackling the topic of male breast cancer. So men can develop breast cancer just like women. Anytime we're talking about breast cancer, we're saying, I think it implies that we're talking about women. But I think we cannot forget our men. Our men take care of us, so we gotta take care of them. And so some of the key facts about male breast cancer for there's 1% of breast cancers are diagnosed in men. One man to every 120 women ratio of getting diagnosed with breast cancer. In the United States, 2,800 men will be diagnosed with breast cancer, and unfortunately, we'll lose 530 of them, according to the American Cancer Society. I have been seeing a lot of male breast cancer, and it's most likely increasing obesity and the same risk factors like increasing age, obesity, or risk factors for men to develop breast cancer. They are diagnosed a little bit later stages than women is because I think they're not thinking about cancer and maybe they're not examining themselves. So, Dr. Diwani, do you see male breast cancer and what are some risk factors for
Yeah.
male breast cancer?
So absolutely, like you pointed out, like male breast cancer is not something that typically male usually,
Yeah,
brings to attention because there is not a lot of awareness. So we really want to make sure with October being the breast cancer awareness month that we also pay attention
yeah,
to our males, increase the awareness of male breast cancer because the numbers that just Dr. Halaharvi
yeah,
quoted, those are not small numbers. Like
yeah,
for
no,
every 120 female, you have one male who would get diagnosed with
yeah,
breast cancer. Talking about, like you pointed out, one of the risk factors, like, why are we seeing this increased incidence?
yeah,
One is the high BMI, obesity, use of certain hormonal supplements that increases that risk. And then we talk about genetic risk factors.
yeah,
So if you have a strong family history, especially in a male having a breast cancer or bilateral breast cancers, or certain genetic syndromes, like if they have a gene like BRCA1, 2, P10, we talk about P53,
yeah,
those all increases risk for breast cancer. There is also something called as Klinefelter syndrome, which also increases their risk for breast cancer by 50-fold. So apart from all those genetic things, high BMI, there is also some association with certain types where we can diagnose the gene
yeah,
that we know of, but we know there are certain associations with strong family history. association of pancreatic, prostate, and melanoma. So it would be very important for those genetics to play. So it is recommended that if a male has a breast cancer, they definitely have
Mhm.
a genetic testing because of the implication on screening their family members and as far as their treatments too,
Yeah.
because it would imply both have implications both from surgery and systemic treatment standpoint.
Yeah, yeah, that's really good information. I think the genetic testing it's important because it's so uncommon to have cancer in men. If you have cancer, it's important to reach out to a genetic counselor to get tested, a panel testing most likely to make sure you don't
Sure.
have any of the genetic mutations. If you do have a genetic mutation, then your family member definitely needs to be tested. So
So how do you, Dr. Halaharvi,
yeah,
like how do this male presents to you? Like,
yeah.
because they usually present in late stages, but how do they typically
Yeah.
present to you?
Yeah. So, just men don't have screening guideline recommendations like women do. So they usually come in because they're feeling a mass. And
Okay.
most typically, the mass is felt right behind the nipple and it's usually firm. And there's also another entity called gynecomastia, which, we
Okay.
don't talk about a whole lot. I see men who come in to see me with gynecomastia, and that's a benign condition. And that is where men come in with this, what looks like a mobile mass, meaning it moves around nice and round, well circumscribed. And I see that in young boys in adolescent, early 20s, and also in their 60s. It's just the changes in the hormones that happen. And it's really more of a cosmetic problem, like when young men are lifting weights, things like that, in the locker room.
Okay.
Sometimes they're embarrassed of there's asymmetry in their breast, and they usually come in to be worked up for that. And that is not breast cancer, that is benign. And we typically don't remove that unless they're having pain or increasing in size. A cancer typically, they come in with a firm mass, it feels hard like a rock, not as mobile. And sometimes pulling in the nipple or the skin. I've seen men who come in actually with nipple discharge as well,
Oh, wow.
and that is clear or bloody. And so that's how they come in. And typically we get ultrasound and a mammogram, just like we do for women, and they get biopsy either using an ultrasound or mammogram guided, and we wait for the pathology results to come back, and then we see them back in our office where we discuss. They show them the pictures, talk about their pathology and their staging. Staging is the same as is done for women: the size of the tumor, the grade, the hormone receptors, the lymph nodal status, whether cancer is outside the breast. Um,
Or
all of those factors go in when we talk about staging.
okay. And then so once you have diagnosed them that they have breast cancer based off the biopsy with imaging, how do you walk them through their options in terms
Yeah,
of
yeah.
surgery?
So again, very similar. So first thing we do is we present them at our multidisciplinary tumor board conference where Dr. Dewani is present as well as other breast cancer experts are present. And we provide personalized care. So not every breast cancer is treated the same, not one size fits all. So we talk about the stage of the tumor, the hormone receptor. So typically, if it's a small tumor, hormone receptor positive, which is the most commonly what we see for men, and they typically tend to go to surgery first. And most common surgery really is still a mastectomy, removing the breast tissue, just because men don't have as much breast tissue
Okay.
to get a lumpectomy. And lumpectomy typically needs radiation. So if they don't have enough breast tissue where we remove the tumor and have good cosmesis, we typically perform a mastectomy with a
Okay.
sentinel lymph node biopsy where we sample the first draining lymph nodes. Back in the day, men were getting what we call a modified radical mastectomy, where they removed the breast tissue along with the lymph nodes. But we saw that the morbidity of the procedure or the complications of that is higher than someone who gets a mastectomy with a sentinel lymph node biopsy. A lot of the surgical options for men is really extrapolated from the research for women. So,
And that's very true for the
yeah,
systemic treatment too. Like a
yeah,
lot of the data for the
yeah,
male breast cancer is
yeah,
derived from how a female breast
yeah.
cancer is treated.
So, how do you determine if a man needs chemotherapy before or after surgery?
So good question. So a lot of it depends on the stage and the tumor biology. Very similar to how you would approach a female breast cancer. So if and we talked about like male breast cancers being more hormone
Mhm.
positive. So if you have a hormone positive male breast cancer, then you talk about what the stage of the disease is. Is
Mhm.
it just localized to the breast? Has it gone into the lymph nodes? If it is, then how many lymph nodes are positive? That all takes into account in terms of deciding the treatment.
Mhm.
We do utilize a test called as 21 gene recurrence score,
Yeah.
also known as oncotype. It's a genomic testing. There are different genomic testing that are available that we utilize, even though the data is very small for male breast cancer. But again, the same concept of trying to extrapolate that data from female breast cancer, utilize that in terms of making a decision for their systemic chemotherapy. So typically, if you have more than 4 lymph nodes, pretty
Mhm.
much the chemotherapy is something that is standard that we would utilize. If you have a small tumor, don't have lymph nodes, then we talk about using anti-estrogen. If it is hormone positive, something HER2 negative, we use anti-estrogen treatment. We typically utilize something called as tamoxifen,
Yeah.
which is an anti-estrogen, which kind of acts like an estrogen in your body. And in males, we try not to use something called as aromatase inhibitor, which is a medication which is anti-estrogen for postmenopausal female. If we had to use it for some reason, we always combine it with a shot that we also use in premenopausal
Yeah.
females to shut down their estrogen production. So typically we use it in combination. Like I said, for most part, we use tamoxifen.
Mhm.
There are certain reasons why we can't use in men if they've had history of blood clots or if they had multiple lymph nodes or high risk factors for which they may go on a targeted treatment.
Mhm.
So when you combine the tamoxifen and the targeted treatment, it increases the risk for blood clots. So in those situations, we sometimes utilize the alternative of what we call as aromatase inhibitor and a shot along with the targeted treatment.
That's really interesting.
So that is something from the anti-estrogen
Mhm.
standpoint or hormonal for hormone positive.
Mhm.
If they're triple negative, it's pretty much a similar type of chemotherapy. You would, again, if they're more than 2 centimeters
Mhm.
or lymph node positive, we would like to go with chemo first and we would combine chemo with immunotherapy.
Mhm.
And here again, the genetics would come into
Yeah.
play, how we utilize those medications after treatment if they still had disease after undergoing the treatment.
Yeah.
And then the third subtype that we talk about is HER2 positive. Again, if they are more than 2 centimeters, hormone positive, we would like to use that anti-HER2 treatment upfront before surgery to try and decrease the tumor size
Yeah.
and the lymph nodes.
Yeah.
We try to clear out the disease as much
Yeah.
as possible in the lymph
Yeah.
node. We try to brag to our patients telling this is a knifeless surgery that medical
Yeah,
oncologists do.
yeah. Actually, you guys do a lot of good knifeless surgery, because of these great targeted medications and the treatments that we have for the triple negatives as well as the HER2 positives. In addition to the chemotherapy, they have immunotherapy for the triple negative, like you're
That is
talking
correct.
about, and the HER2 targeted therapy. When we take them to surgery, we find really good pathologic response where the tumor is gone. So I usually tell the patients, Dr. Dewani really treated you. I just removed it to prove it that there is no cancer here. So we appreciate it as surgeons. We appreciate you taking the patients and in giving them the chemotherapy before surgery, something called a neoadjuvant chemotherapy, especially if someone who has a lymph node positive disease.
Exactly.
And if there's cancer in the lymph nodes, typically, they need a lymph node dissection. But with the chemotherapy, hopefully the cancer is completely gone. We still remove that lymph node and a couple of other lymph nodes called targeted sentinel lymph node biopsy on the back end. And if there's no cancer in the lymph nodes, they do not need lymph node dissection. So what we say, it's downstages the surgery, which is great for the patient. I mean, as surgeons, I want to operate, but I want to do the right thing for patients. If they don't need additional surgery, a axillary lymph node dissection is associated with complications of lymphedema, numbness, and neuropathies and things like that down the road. So if we can avoid those type of complications, physicians like Dr. Dewani, the oncologist, they are treating the cancer. So all we are doing is proving it that there is no cancer in the lymph nodes, so they do not need to have such an extensive
Surgery.
surgery. Yeah,
And it is a very interesting concept as the world of oncology is evolving.
yeah,
Previously, a few decades ago, we used to do more extensive surgery, more extensive
Yes.
chemotherapy. As the time is going by, we are learning more and more that more may not necessarily be better.
Yeah.
So now the care is more towards de-escalation,
Yeah.
lesser surgery, lesser chemo,
Yeah.
lesser treatments, and we are getting equivalent or better results trying to bypass some of the side effects
Yeah.
or toxicity from the treatment that would
Yeah.
come.
And you make a really good point, Dr. Dewani. De-escalation is the word. So we are doing lesser surgery, but giving you the same survival, lesser chemotherapy, giving you the same survival. And it's really important for you to find a doctor who is knowledgeable enough for you to provide you the most recent and the greatest, latest technology, whether it's surgery, chemotherapy, and, you want to find doctors who present your case at the multidisciplinary conference. We present all of our cancer patients at the multidisciplinary conference where there's other experts, where we get together and talk about what is the best care for this patient. And we provide very personalized care, whether you're a man or a female, whether you're pregnant or not pregnant. And so it's important to find your care team who is involved in multidisciplinary conference, who keeps up with the research. And speaking of research, as male breast cancer, we don't have enough research. And it's really
Absolutely.
important to take part in the clinical trials, because you are leaving your legacy by taking part in these trials. You're helping people that come behind you. And that's how we're able to de-escalate things, is because people are taking part in the clinical trials, which then helps people that come behind you.
Absolutely, it's such a great point. I mean, I cannot stress the importance of multi-modality conferences and
Yeah.
clinical trial. And we do have our clinical trial folks on our conferences, and they look through your whole records and say if there is a potential trial, and they may actually reach out to you telling, hey, you would be eligible for XYZ trial.
Yeah,
So,
yeah.
yeah.
So I had a male breast cancer patient who's taking tamoxifen, said to me that, "Oh, Dr. Halaharvi, was watching this commercial, and out of nowhere, I just started crying." And he's like, "Is this because of the tamoxifen? What kind of side effects do you see in men with the anti-estrogen medications?"
Yeah, so it does cause hormonal fluctuation
Yeah,
in males
yeah,
too. So it can cause some mood swings. It does happen in
yeah,
males too. They can experience hot flashes.
yeah,
Some of the side effects of tamoxifen is very similar. What would
yeah,
happen with the female, like a hot flashes,
yeah,
mood swings. We talk about blood clots,
yeah,
those things in males too. Yeah.
yeah, yeah. I thought that was interesting. I mean, which makes sense.
And then again, there is things that we can do to help you deal with
Yes,
it. It's not like,
yes,
oh, take this and, so
yeah,
there's definitely things that
yeah,
we can actually. So if you have hard flashes or
yeah.
if you're experiencing more emotional swings, then we want to know so we can help you.
Yeah, absolutely. So do you recommend like magnesium and vitamin E, just like we do
So
for the women?
yeah, so
Yeah,
if they have hot flashes,
yeah,
then we try and first use non-prescriptional things to see if it can help, like magnesium or vitamin E. If that's not helping, then we kind of give you something more prescriptional. There are a lot of options in terms of drugs that we can utilize to help with the hot flashes, and a lot of it depends based on what your medical history is, what
yeah,
your other problems are, to pick the right medication to help with your symptoms.
yeah, yeah. So, Dr. Diwan, is the survival any different in men compared to women?
So, really good question. If you take the exact same stage
Yeah,
and you take the exact same biology of the disease
yeah.
and compare to a female, it's actually the same.
Okay.
So, typically we worry about, oh, male breast cancer, behaving because it's a male, it's bad, but it's because they usually present in more advanced
Yeah.
stages. But if you take the same stage, same biology, and compare to female, it's pretty similar.
Yeah, yeah, yeah. I think that's so interesting. And again, it all goes back to being your own advocate, whether you're a man or a woman, doesn't matter how old you are. Breast cancer does not discriminate. It does not discriminate if you're a man, if if you're white, black, yellow, whatever color. It does not discriminate. We see patients of all ethnicities and genders. And I think the main take-home message from this podcast is be your own advocate. Do your breast exams. If you find something, you feel something that doesn't feel right, make sure you're talking to your providers and getting it worked up. So,
Absolutely, absolutely. We cannot stress the
yeah.
importance that if you feel something abnormal, please get it checked out. Better safe than sorry.
Yeah, that is correct. So the whole goal of this podcast is to empower you, educate you so you can be your advocate and live your best life. So this again is just a chapter of your life. Our hope is that you take this information and you go on to have a better life once you get through the treatment. And our goal is to help you to get there. And Dr. Dewani, thank you again. As always, it's such an honor and a privilege to have you here on the show.
It's a privilege to be part of this amazing podcast. So thank you for having me and giving me this opportunity to be
You're
part of
welcome.
it.
Thank you. Thank you. And for listeners, I hope you found this information to be valuable. And if you did, please share it with other people, friends and family, and give us a 5-star rating, if you will. And thank you so much for taking the time to join us today. Hope you all have a good day. Bye-bye.
Thank you.
Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdeepahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer: this podcast is not intended for complete medical advice.